Hi. This is a brief introduction of Remicade, which contains infliximab. Infliximab is chimeric monoclonal immunoglobulin G1 antibody to tumor necrosis factor alpha. And tumor necrosis factor alpha, as you know, is a key cytokine which is responsible for chronic and sustained inflammation in chronic inflammatory diseases, for instance, Crohn's disease, rheumatoid arthritis, ankylosing spondylitis, plaque psoriasis, etc. As far as mechanism of infliximab is concerned, it downregulates the GM-CSF expression from T cells, which is granulocyte macrophage colony stimulating factor. When its expression from T cells is inhibited, this results into apoptosis of T cells. And as a result, the inflammatory process is stopped, followed by healing of damaged tissues. In Crohn's disease, infliximab can be used in both luminal or fistulizing disease. When disease process is restricted to the lumen of the intestine, then a single dose, which is 5 mg per kg of infliximab or Remicade, is sufficient to treat this condition, to heal the tissue and to subside the inflammation. But when the disease is fistulizing, then you need a loading therapy of 3 doses of Remicade at 0, 2, and 6 weeks of therapy. Now I would like to share a study which was conducted to evaluate the safety and efficacy of infliximab or Remicade in patients with long-standing ankylosing spondylitis. 25 patients were studied in this trial. All of them were fulfilling modified New York's criteria for ankylosing spondylitis. 22 of them were HLA-B27 positive. All of them were having active axial disease with BASDI of 30 or more, which is BATS ankylosing spondylitis disease activity index, and CRP 10 or more milligram per liter. These patients were given Remicade at 0, 2, 6, and every 8 weeks thereafter for 12 months. The results were quite satisfactory after this trial. It was observed that there was significant improvement in GAP or Global Assessment of Pain at 100 mm visual analog scale, and there was significant reduction in BASDI score and CRP as well. So the conclusion was that infliximab or Remicade was found to be safe and effective in patients with long-standing ankylosing spondylitis. Thank you.